42-year-old Peter Austin didn't know it then. He didn't know his 3-mile drive to work would change his life.
I started feeling a burning in my chest from shoulder to shoulder and down in the front, so it was a T-shaped burning.
Peter kept on driving, figuring he was just anxious.
At the time I was a smoker, so I lit up a cigarette figuring that having a cigarette would reduce my anxiety as a stress reliever.
It didn't. Peter kept ignoring the symptoms, got to work, and felt worse.
Really started sweating profusely, and I went to go see a coworker, and I asked him to please call an ambulance. I needed some help. And I just remember sitting on the floor and people were gathering around, watching Peter have a heart attack.
That day, Peter joined a club with more than 1 million members. Statistics show each year more than 1 million men and women have a heart attack, and nearly half die because they didn't get to the hospital in time. Experts say every minute the heart artery remains closed, the greater the heart muscle damage.
I never added up the symptoms, said I'm having a heart attack. I thought maybe it was indigestion or stress, some anxiety as I was heading to work.
You know how many times patients think they just have heartburn?
Dr. Pradeep Jamnadas at Florida Hospital is Peter's cardiologist. He says a lot of people think you're supposed to clutch your chest like a Hollywood heart attack.
For example, some people only get pain in their jaws. So they get a pressure, heavy feeling, or a tight feeling in their neck. Many people think it's a pain, but actually it's not a pain. A heart attack is not pain, it's a pressure, it's a heavy feeling, it's a tight feeling across the chest. This tight feeling is often misconstrued by patients thinking, oh, this can't be a heart attack, because a heart attack has to really hurt. It doesn't have to hurt, it's a tight feeling. Hey, good morning.
Hi, how are you?
Good, good.
Dr. Jamnadas and Peter have formed a partnership. The goal, to make sure Peter's first heart attack is his last.
Got to keep an eye on that cholesterol level.
Yes.
So we'll be doing a lipid test on you. 2, your blood pressure is not an issue, but we'll keep an eye on that.
Right.
3 is continue your exercise program. 4 is watch your stress.
Peter knows the drill. These days, lunch looks a lot different.
Absolutely, I used to eat chicken wings, which I'm not sure if there's anything worse for you.
With a low-fat diet and medicine, Peter's cholesterol is down.
It's a good workout. I'm still getting used to it.
For the first time in 10 years, Peter is exercising. And 4 days in the hospital helped him quit his pack-a-day habit.
Stop smoking, number one, first and foremost, and diet and exercise. 3 things you have to do, I feel, at least from since I've been looking into it.
For a guy who never thought he would have a heart attack, he now knows how to prevent another one, thanks in part to Dr. Jamnadas.
The cardiologist is providing the support and knowledge for things I need to do now and into the future to maintain my health. And I count on the cardiologist very much. I think, yes, I think I am pretty lucky, to be honest with you, and kind of blessed that things turned out the way they did.